Today we're honored to have with us a physician from St. Jude Medical Center who has been an intensivist and a pulmonologist at St. Jude for the last 30 years. He did his medical school training at Baylor University. He was at Los Angeles County USC Medical Center, and he took his specialty training at UCI in intensive care and pulmonology. Dr. Jim Hardeman has been at St. Jude for 30 years. He has written a book, as Russ mentioned, on how to appear younger than your stated age. And I can tell by looking out here that there's no one here that actually needs that. Well, I mean, the women, the ladies don't need it. The guys, they better listen. So anyhow, it's an honor to have with us today Dr. Jim Hardeman. So please welcome Dr. Hardeman. Jim.
Thank you, Dr. Lawton, and also thank you for all the efforts that you put into recruiting speakers like me to come to this program. You know, if you look at Joe, he looks pretty kind and gentle, which he is, but he also is a good arm twister. And so if everybody could just give him a round of applause again for all of his efforts. So my name is Jim Hardeman, and the topic of my talk today is actually what I call the art of aging. Now that may mean different things to different people, but I mean basically to me it means living a pursuit of living a long, happy, healthy life. So as I look around the room here, I see that most of us have kind of been around the block once or twice, and we've heard all the cliches about getting older, I'm sure. It's better than the alternative. It's not for wimps. The golden years are not always so golden. But the 100% truth about getting older is that unless you die, it's inevitable. And when things are inevitable, we can learn to prepare for and adapt to the inevitable changes that are going to occur in our bodies. So I guess I'm going to try to justify why maybe you should listen to what I have to say this morning. First of all, I'm a physician. I've been practicing pulmonary and critical care medicine for more than 35 years. I help to take care of the sickest of the sick patients in the intensive care unit. And it probably comes as no surprise to anyone that many, many of the patients that I've seen there could have avoided being there if they had used a little bit more preparation and taken better care of themselves. It's kind of been hammered into me day after day when I'm in the intensive care unit. And so when I do the things myself to try to stay healthy, you know, watching my diet, getting up and exercising, I don't always feel like exercising in the morning, as a lot of people would share, but I think to myself, it's far better than being a patient in the intensive care unit. I'm also an author, sort of. I did write and self-publish a book that looks like this. It's called Appears Younger Than Stated Age. Now that phrase is one that I learned early on in medical school. It is a phrase that has been used by doctors for many decades to describe patients who look really good for their age, basically. So I've paid attention to these patients. I've talked to them. I've asked them their secrets. I tried to put in my recommendations for healthy living here, because most people who look good for their age are healthy. That's what I have determined. So obviously genetics and good luck play a role, but if you're healthier, then you're more likely to look good for your age. And so what I decided to do was use the get it from the vanity angle here, I'm really not that concerned about looking younger. What I am concerned about is getting people healthier. But had I termed the title of my book, How to Be Fit and Healthy, it would have elicited yawns, and here I'm trying to get people to say, oh yeah, I'll look better. Maybe I will try to be more healthy. So I was hoping that maybe by writing this book I would launch myself as to be a spokesperson for healthy living. I think that it has almost everything you need to know about being healthy in it. But as we all know, you can't always get what you want. The good news is, though, that I have a bunch of leftover books still that my wife has really been bugging me about. And so at the end of the lecture, there's some boxes there. Whoever wants one, as long as they last, is welcome to a free book. Okay, getting back to my justification, my qualifications, I think that I have common sense. It's necessary to practice medicine. It's necessary to lead a healthy lifestyle. And I think it's necessary to live life in general. And then finally, it's not like I'm some 30-year-old trying to advise people twice or more his age about how to live and be a healthy oldster. I'm old, too. I have my very own Medicare card. I'm considered a senior citizen. And so I'm trying to walk the walk, but I have also, I'm trying to talk the talk, but I have also walked the walk, the very long walk, it seems like sometimes. You know, we're kind of all in this together, and these are just kind of my recommendations over a lifetime of being a physician and also trying to lead a healthy lifestyle myself, which has been one of my sort of hobbies, I guess. First of all, we're going to discuss the changes on the outside versus the inside. You know, one of my first patients when I started practicing medicine was probably in her late 80s or 90s, and here I was in my early 30s, and she said to me, you know, you're going to find out as the years go by that even though you know you're older, you feel like you're just the same person inside. You feel like you're still 20. And obviously, that everybody I've ever talked to about that feels the same way. And part of that is that I guess our personality traits, our emotions, our personal guidelines stay the same, and we all have the potential to possess the triumvirate needed for healthy living, which I refer to as reason, free will, and common sense, which allows the self-determination and self-discipline to lead a healthy life. And you know, I read in a Stephen King book one time, you know, you get these little quotes that stick in your mind, and one of them, one of the characters kept saying over and over again, kind of his mantra, do the day and let the day do you. Obviously, we know that that's true. There are a lot of things in life that we do not have control over. But when it comes to healthcare, there are very many things that we do have control over. And we need to utilize these if we're gonna lead a healthy lifestyle. The next topic is the battle to maintain IBW, ideal body weight. This is probably the most important theme of my book and my philosophy about how to be healthy. And the reason is because if you stay at your ideal body weight, that means that you have to be doing something right. You have to be watching your diet to some degree and exercising. I mean, there is no other way in our modern world. Now, some people have asked me in the question and answer, well, what is the IBW? What is it? There are on the internet different formulas. Another criterion is called the body mass index, BMI, that is increasingly in the electronic medical record at your doctor's. And you can look up the formulas for those things. But I mean, a basic estimate would be the weight when you graduated from high school. Now, when I said that, it kind of elicited some groans from the audience, and I recently read something where someone was a little bit more charitable, and I liked that, so I thought I'd let you know that they said age 21 plus 10 pounds. So, but again, in order to maintain ideal body weight, you have to be paying attention to your health. Now, the reason that there is an obesity epidemic in our country and a lot of parts of the world is because genetics has not caught up to our modern world. It's only been in the last little sliver of human existence that the threat of being undernourished or starving has basically been eliminated in a lot of parts of the world. In fact, in some areas, including the United States, the opposite is true, that even people who live in poverty these days are more threatened often by overeating rather than undereating. And so, you know, there's no doubt that our ancestors, had they not stuffed themselves when food was plentiful, would not have had the fat stores to be able to live through the lean times. So that's why we want the, you know, a second or third piece of pie or whatever. That's what we're programmed to do. It meant survival in the past. It's just that our genetics have not caught up to the fact that we do not generally have food insecurity at this point. Furthermore, in our modern world, people know how to make food taste really good, and it's hard to deny it sometimes. You know, I saw an interview with Charles Barkley one time, and he was talking about that he would be driving down the street, and it was as if the Krispy Kreme donut place was calling to him to go in. And so that makes it difficult, as does the fact that we have so many energy-saving devices, from cars to garage door openers to remote control devices. And so, you know, walking from the couch to the refrigerator just doesn't cut it as far as exercising. And our ancestors had to do a lot more work than that to obtain food in the past. So as we get older, you know, most things about us, I think all of us could say, kind of get worse. We have more joint pains, the heart function may not be as good, the lungs do not work as well. There are decreased resting metabolic rates, so we don't burn as many calories for doing nothing. In fact, almost everything about getting older is worse in our bodies, with an exception, and that is wisdom. And we can use this wisdom to say we accept, but we will not capitulate. We need to stay active physically and mentally and watch our diets in order to try to lead a healthy lifestyle. This quote is attributed to Mickey Mantle. I think most of us hope that we're going to live long enough, and like I said, except for dying, the other inevitable thing is that we're going to get older, and so we know it's going to happen. We need to make preparations and adapt to it. And so what I'm proposing is to combat aging by staying active and maintaining ideal body weight. And it's more difficult the longer you wait. You know, there's no question that if you are 35 pounds above your ideal body weight, it is a much more daunting task to get back there than it is if there's 3.5 pounds. And what I'm advocating is that if you see any change, then you act upon it immediately by adjusting your activity level and your diet to get back to where you are, where you should be at your ideal body weight. And what we want to try to do is avoid the vicious cycle of sedentary living. As I said, our basal metabolic rates decrease probably by 2 or 3% every decade after age 25. And so, whereas in our 20s, say, our bodies are like kind of a raging furnace that burns calories without us having to do much of anything, that slows down. And so, inevitably, we're going to gain weight unless we do something different. A lot of patients have come into the offices and say, you know, I exercise the same, I eat the same, and yet still I'm gaining weight. Well, there's a reason for that. The resting metabolic rates decrease. And so what happens with the vicious cycle of sedentary living is that as we gain weight, that puts more pressure on the supportive skeletal structures like the back and knees and hips. We maybe are less active because it hurts in our joints. We gain more weight, that puts more stress on the joints, and on and on. So if you're in that vicious cycle, we need to try to break out of it. And if you aren't in it, you try to never enter into it. So my core program for 65 and better, I always like that 65 and better because it's so obviously a Madison Avenue invention. It used to be 65 and older, but I guess that's good. We're better now. But walking and weightlifting. Okay, now I'll talk a little bit more about the weightlifting later, but basically we want to do things that maintain the integrity of the musculature in the upper and lower extremities. This is definitely what we don't want to say into our life alert buttons. People often fall and can't get up because they've hurt themselves, but sometimes they simply can't get up because they lack the muscle conditioning and strength to do so. In fact, even the spouse sometimes can't get them up. I've heard numerous occasions where paramedics have come out to the house just to lift the patient back up into his chair because he didn't have the strength to get up on his own. And in those cases, fortunately, there wasn't a lot of damage done as far as any fractures or anything. So we've all noticed that we develop habits. Our habits change depending on our stages of life or our experiences. But to be human is to be habitual, and what we want to try to do is to get into good habits, get rid of the bad habits. You know, if you like to have a beer or two before dinner and you are not at your ideal body weight, then I would suggest substituting a walk for it and let that become your new habit. We want to try to toss out the self-destructive and bring in the healthy habits, and it's never too late to do it. I think that's what I've counseled my patients for many decades, is that you know, what I have to propose would probably be best started when you're a teenager, but not everybody obviously has that foresight at that age. But it never is too late. I've seen people improve their their physical health significantly at any age by trying to be more healthy. So is the food, is it addiction or genetics? Well, it's hard to say for sure, but either way, and I think it sounded to me like Charles Barkley was addicted to Krispy Kreme donuts, but genetics does make us want to eat more when there is food available. But like I said, we possess the reason, free will, and common sense to say, that's okay, well, I'll pass on it because I'd rather lead a healthy lifestyle. And basically, you know, you have to pay now or pay later. Getting up in the morning to do your exercises, like I say, is not always something that people feel like they just want to bounce out of bed and do. But being a patient in the intensive care unit is paying multifold later. So aches and pains are pretty much universal for us, and they're also a frequent excuse not to engage in exercise. But what you need to do is perhaps shift the type of exercise. My criterion is if it really hurts when I do it, it's probably not worth doing that type of exercise. What I'm surprised at, though, is that when I wake up and I say, oh man, my back is hurting me a little today, and I start to do my weightlifting routine, that it doesn't really hurt that much. I'm able to do it. And so I think it's worth trying, but if it hurts, I think laying off that type of exercise. But if you can't run, you walk. If you can't do that, you do some the weight training that day or something that doesn't hurt as much. Sometimes varying your routine will allow the muscles to recover. Now, I don't think that walking is, you have to do that. I think you can walk every day. If you run, maybe doing it every other day would be better. The lifting weights, generally I do every other day. It allows the muscles to recover. But when I'm talking about walking, I'm really talking about at least an hour a day. That surprises some people. I mean, people come into the office and they tell me that they walk a mile 3 times a week. Well, you know, the fun size Milky Way bars that they give out at Halloween time, they're about 2 by 1 inch and about a ½ an inch thick. They have about 80 calories in them. That's sort of like walking a mile. And it's, you know, you could eat 5 miles worth of those Milky Ways in a short period of time. As far as medications, that we can take to help with the aches and pains. Generally, I recommend Tylenol or acetaminophen first because it is probably the safest. It may not be the most effective, but it's worth trying. NSAIDs, non-steroidal anti-inflammatory drugs, are ibuprofen like Advil and Naproxen, Aleve. Can be helpful, but they may have more side effects, kidney side effects, and it can irritate the stomach and cause ulcers if you use them on a regular basis, although every once in a while is probably not going to hurt. Opiates, you know, obviously we want to try to avoid those if possible. Some people can't function without them. And there are some other ones, Lyrica, gabapentin, that kind of scramble the nerves, and for people with chronic pain, they can be of some benefit. But there are also non-pharmacological ways of treating pain, including physical therapy, massage, heat and cold packs. Here is a very cheap cold pack. It's a paper cup, frozen, and you tear off the top, and you can hold on to the bottom and ice the part that hurts before your activity or afterward. Or frozen peas, and they conform to lots of areas of pain, a knee or elbow or neck or whatever. They also obviously at the CVS or Walgreens have these freezable cold packs that can be of benefit. What we'd like to do is try to put less stress on our weight-bearing joints, though, by maintaining our ideal body weight. Impact is a big part of the aches and pains, and so we want to usually try to minimize this. And you can minimize it by walking or biking, swimming, water aerobics, stair-stepping, the elliptical machine, and so forth. Recumbent bicycles, I've been told by a lot of people, help to eliminate the back pain, so like a stationary recumbent bike might be useful. The thing about walking is that it is so universally applicable. If you can walk more, you can do more. And so I think walking should probably be part of everybody's core exercise program. If you can't do it an hour or an hour and a half a day, then I would suggest trying to break it into 3 or 4 episodes, because the calorie burning benefit of it is the same. Also, walking may help to prevent osteoporosis, thinning of the bone. The bones, more so than the less impact activities like swimming or cycling. So that's another reason to have walking in there, although doing the others as well would be good. Now, upper body strengthening helps maintain independence. There actually have been studies to show this. And, you know, I'm talking about weight training, but I'm not anticipating that we're going to look like Mr. Universe. You know, I lift weights, and I don't think anybody would mistake me for Arnold Schwarzenegger. But it helps with your balance, and it helps do the things you want to do. And like I say, God forbid that you fall, it helps you to get up. Now, I don't think you need to even belong to a gym. In fact, I use these at home a lot now. I used to use them just for traveling. Body Elastics. I don't own any stock in this company, by the way. But it says on here, don't live in a gym, just look like you did. It's got rubber bands with firm clips on there, and you can adjust it. And it's very convenient, safe, and easy. You know, if you have to get out of the house and go to the gym, that's just one more step that's going to be an impediment to you. And this, along with, I have some light dumbbells as well. It can be your personal gym for, you know, the price of 1 month of subscribing to a gym, basically. So we want to maintain our balance. Less activity means poor balance, and so the more active you are, including both the walking, the lower extremity, and the upper extremity training, the weightlifting. One of my big pieces of advice to my older patients is don't fall, and although nobody intends to do it, we often don't do the things to prepare ourselves so that we don't. If you do feel like you have trouble with your balance, oftentimes you can talk to your doctor about getting physical therapy for it, which there are specific physical therapy maneuvers that can help maintain your balance. Assistive devices. You know, people hate canes and walkers. Just from my own personal perspective, I like to hike. I used to kind of look at the people who used those hiking sticks as being wimps or something, but we went on a hike that required that we have them, and I have become a complete devotee to them. I can see that that's going to extend my career of hiking by years probably, and it's much safer. And so I decided I don't care what I look like. The same thing should go for a cane or a walker. If it helps you to be able to walk, then you're going to be much healthier overall, and you're going to be more stable, and basically who cares what you look like. Okay, the mental workout. We need to have good, strong bodies, but also we got to have intact brains, otherwise it's not going to make too much difference. You know, when I was in high school, they said, well, if you want to be a doctor, you better take Latin, which was very bad advice. I should have taken Spanish. But one thing that we did was we would make these posters of some of the Latin sayings, and this was one of my favorites, mens sana in corpore sano, which means a sound mind in a sound body, and that's what we should all aspire to. They actually sort of tend to affect each other sometimes, especially people who develop trouble with their memory. If people have cognitive dysfunction from dementia, Alzheimer's, often once they develop that, the body seems to follow. Interestingly, the other way around is not always true. A good example was Stephen Hawking, who had amyotrophic lateral sclerosis and couldn't really even move, but his brain was intact and he was able to communicate with the computer, which was amazing. So maybe we should all be doing crosswords or playing cards, doing puzzles. You know, they say there's no such thing as a demented bridge player. Reading, keeping up on current events. Notice that I did not put watching television in this list. But perhaps what is the most important part of maintaining mental functioning is exercising. Is that it has been shown pretty conclusively that people who exercise regularly help preserve their cognitive function. Whether it is better blood supply to the brain or prevention of arteriosclerosis, it's not clear, but yet another reason to exercise regularly. Now, common sense keeps coming up in our discussion. When I was writing my book, actually, I was on the part about common sense when on the news I heard that there was a big swell at the Wedge in Newport Beach. And most people have heard of that who live in Orange County, but the reason the surf gets so big is that there is a jetty. You can see it at the top of the picture there. That down below there's a body surfer. And with the right kind of swell, the wave comes in, it kind of refracts off the jetty, and then it combines with another incoming wave, and it really jacks up the height of them. So it can be the biggest around at the Wedge. And young body surfers and sometimes even surfers and bodyboarders like to challenge it. Well, on that day, unfortunately, they reported that a man died while body surfing there, and he was 50 years old. Now, all I could think about is what is somebody who is 50 years old challenging a wave like that for? It just totally violates common sense. So we need to exhibit common sense as we get older and realize that there are some limits, but there are still plenty of things that we can do that are fun.
Where did that happen?
At the Wedge in Newport Beach. I don't remember exactly what the streets are, but it's kind of legendary for body surfers. I went there when I was a teenager, but I was stupid then when I heard about all the people who developed cervical spine fractures and were paralyzed from it. It doesn't make any sense to do it because it breaks in such shallow water that it is extremely dangerous even for people who are experts. Okay, I think that we need to accident-proof our homes. Russ, are we okay? Fine. Because we don't want to fall. We've already established that. And if we do fall, we do not want that to happen to us. This is a photo on the patient's right hip, which is on your left, is fractured. The normal hip is on the other side. It's kind of the scourge of old age, is falling and breaking your hip, and we want to always try to avoid that happening if possible, and utilize preventive measures. Most of the time this is going to require surgery, and the orthopedic doctors like to have somebody like me, an internal medicine type doctor, give what they call medical clearance beforehand. So I've seen a lot of people who have had hip fractures because they want my blessing. Yeah, they're healthy enough to undergo surgery, and which almost everybody is, because the alternative is so bad. You can't walk on that hip for months and months on end. And you can get up maybe the next day with surgery. And so this is what it looks like when you've had a hip replacement. So I always ask people, how did it happen? And there are some things where you just cannot help it. I remember one woman who was at a gathering at her house, and somebody fell, and he fell into another guy who fell, and he fell into her, and she fell and broke her hip, and the other two guys were okay. So, I mean, there isn't too much you can do about that. But there also is a lot you can do to try to make sure you're not in a position to break your hip. Stairs are very dangerous if you're not paying attention. So I think that as we get older, we should really eliminate daydreaming when we're going up and down stairs. Be very careful if you're carrying any items. If you have to drag it down the stairs, it's safer than trying to go down, and especially if you have something in your arms, you can't see what's down below you. You have to be very careful of the stairs. But also, uncoiled hoses, small pets underneath, concrete ridges, speed bumps. I can't tell you how many people broke their hip in a parking lot because they tripped over a speed bump. Step stools, ladders. Well, I decided I would maybe follow my own advice and look at my house and see how I was doing. That is Thor. He does tend to get underfoot, and so we have to watch it. Not too good with wrapping up of the hose. Or here, and then there's a concrete ridge on that. So we tried to fix a few things to be a little more safe. I'm trying to take my own advice here. Having carpet, maybe, other than hard floors, could provide more cushioning. And carrying a flashlight on your keychain, I think, is a great idea, because you just never know when you're going to be in a situation where things suddenly are darker in some room or whatever, and then any unevenness of the floor underneath is a potential area for you to fall. I think this requires no explanation. It's an accident waiting to happen. So what I suggest is wearing flat shoes with good traction on the soles, and that's what I recommend and wear. And yes, I was being careful to maintain my balance when I did that. If you're maybe more than 75 or 80, I just think that it's not reasonable to get up on a ladder. Get somebody younger is what I would suggest. I mean, it just violates common sense, and it's easy to find somebody who's younger and has a better sense of balance. Again, I can't count the number of people that ruined their holiday season because they were putting up Christmas lights and fell and broke their hips. Okay, number 10 is how to die. I thought I better throw this in there too, because my opinion is that if you live a long, happy, healthy life, you probably should die the right way too, because it kind of negates things when you don't. And unfortunately, in the intensive care unit, I see a lot of people who don't die the right way, in my opinion. They have tubes in every orifice. They can't talk. They have to be sedated. They have to have their arms restrained so they don't pull any of them out. And at the final moment, then they undergo CPR, where there's chest compressions, ribs fracturing, and electricity jolting through their body from heart shocks as their last minutes on Earth. Now, many decades ago, I went to a Stanford lecturer who had this slide up there, tube or not tube. Well, he pronounced it to be or not to be to help people remember it. But what we're talking about here is an endotracheal tube, which is a breathing tube. It's put down when people can't breathe. It goes down the back of the throat, between the vocal cords and into the tracheal windpipe, where a balloon is inflated to form a seal. And then you're put on a breathing machine. And it can be life-saving in certain circumstances. It certainly should be used. But I don't think that it should be part of everybody's end of life. And I think that you need to decide for yourself whether that's what you really want to have, because it is so uncomfortable. You know, as I have often told family members of patients in the intensive care unit, there's no question that people suffer. It's like being tortured in the intensive care unit. And we do it with the idea that we're hoping they're going to be able to get better. Well, if you're 95 years old and you're on a breathing machine, the likelihood that you're going to get better, or at least back to a good quality of life, is pretty low. So I generally say if you have some sort of terminal condition, cancer or otherwise, or maybe if you're 85 and above, you really ought to think for yourself as to whether you want that or not. And you are the one who should decide it, not your kids. Unfortunately, because it's a sensitive subject and people don't bring it up, I have plenty of times when the children have to be the surrogate decision makers, and they say, well, really, I don't know. And the children who are most at peace with the situation are those who say, no, they did not want this. They told me many times that they didn't want it, and they're not in the emotional turmoil that the children are, who have to make that decision, not knowing exactly what they would want to have. So you need to have the conversation with your children in particular about it. I've already had the conversation with my children. If it looks like it's hopeless, I don't want to just be kept alive on machines, basically. And if it looks like I'm hopeless, there would be no sense in doing CPR on me if when the final time comes. And the question sometimes arises, well, what about living wills and so forth? And the problem with those is that we never are quite sure what they mean. They were often written years before, and people may have, their status may have changed. So it's a difficult thing to say. So even if you have that advance directive or living will, it's good to tell your family members, especially your children who are more likely to be around when you're not able to voice your own opinion, and have that conversation. Okay, attitude is everything, as many people have stated, and the quote is attributed to multiple different people. But having a good attitude at any age is important. They did some kind of study, and I'm not sure how they would have done this study, but supposedly negative stereotypes in younger people were actually associated with poorer health when they became older. I'm not sure if I believe that, but it does make sense. This was in a Wall Street Journal article that talked about content older people. And I really like this quote. "I'm happier today than I've ever been," said a 91-year-old New York City woman. So, you know, there's kind of a understandable reason to have the woe is me attitude as we get older, because we don't feel like we used to, and obviously the end is nearer than it has ever been. But on the other hand, we have a lot to be thankful for. You know, we made it to senior citizenry, that's an accomplishment. We didn't die when our kids were young, if we have kids, which often emotionally scars them. And a lot of us have had good careers, and a lot of us are retired, which I'm not quite there yet, but it looks like it's going to be pretty fun. So even as we become elderly, if we think we can, we can. If we think we can't, we're right. Checkups, I would say probably yearly checkups would be reasonable with your doctor. People are surprised sometimes to find out that I take high blood pressure medicine. It's not because I don't exercise and eat right and avoid adding salt to my diet. It's genetics, and if I'd never had it checked, I would never know about it. Had a neighbor, unfortunately, that was around 60 who felt great and just had not felt like he needed to see a doctor. He lay down to watch the Angel game, and his family found him dead on the couch. and he had had a massive heart attack. And not necessarily would checkups have revealed that, perhaps, but you're going to have a better chance dealing with the things that can cause strokes and heart attacks, like high cholesterol and high blood pressure and diabetes, which might not cause much in the way of symptoms. So, you know, there's always this healthy living thing. People say, well, I'd rather die than have to eat non-fat yogurt each day, which I do for lunch, by the way. And at the hospital, it's kind of a standing joke because I go into the refrigerator in the intensive care unit, take out my bag and say, I wonder what's for lunch today. And every day it's the same, basically. But on the other hand, I consider that delayed gratification. It tastes good enough, and I'm going to be healthier in the long run if I do what I'm supposed to do. So do you live in the now, or do you prepare for the future? Now, when it comes to healthcare, my stance is these are not mutually exclusive goals, because at any age, eating right, exercising regularly will allow you to look and feel better and enjoy the present more fully. And as you maintain this lifestyle, whether you're entering your 60s, 70s, 80s, beyond, you'll have spent your whole life preparing for that moment. So, with a little luck and the proper lifestyle, perhaps our golden years can live up to their name. Thank you, and I'm willing to entertain any questions. Yes, sir.
Seems like a lot of things, what's right today is wrong tomorrow. Do you have an opinion about the value or the not value to take an aspirin every day?
The question is, it seems like a lot of the things that are right today are wrong tomorrow. And what about the low-dose aspirin controversy? I was up in Mammoth and I got a text message from my brother, so should I stop taking my aspirin? I had no idea what he was talking about, so I had to look it up. But recently, there was some question as to whether you should continue to take low-dose aspirin for prevention of coronary artery disease or stroke. And the answer is I don't know. I take low-dose aspirin because I have some borderline coronary artery disease on my angiogram, and so I think that warrants continuing to take it. I would not stop taking it. My brother said, well, I stopped. And I said, well, don't stop. Keep taking it and ask your cardiologist about it, because he's had stents put in, and so it doesn't make sense to stop it without checking with your cardiologist. I suspect that was of some interest, but what exactly does it mean? You know, one of the problems with scientific studies, you know, people like to say, well, the science is settled, and in my mind, the science is probably almost never settled, is that they're not always reproducible. I think that some reproducible further study is necessary to find out about it. For right now, I think it's the best we have with certain conditions. Certainly, if you have established coronary artery disease or have had a stroke, then that would be a reasonable thing to continue, unless your doctor says no. But I can't imagine them saying that at this point. Yes, ma'am.
Do you believe in natural supplements like ginger and turmeric as an anti-inflammatory?
I think that there is perhaps some benefit. Oh, I'm sorry. Oh, Joe, I'm so sorry. The question is, what about dietary supplements like ginger and turmeric? And I think that there could be some benefit in these, perhaps. I mean, obviously, a lot of the medicines that we have may have started out as, you know, plant extracts and so forth. But the problem is that they are not well regulated by the FDA. There is no obligation for the companies that make these to prove that they work or prove that they're safe. Sometimes the FDA has to come in there and say, wait a second, you took it a little too far. I think maybe some of you remember there was something called Sensa, and they showed people on the beach and you just sprinkle a little on your food and you're going to lose weight. Well, I think that probably the FDA said, okay, we let them say these certain things, but come on, that is way off the chart. No, you can't say that. But that's the problem with medications. They have to be proven to be basically safe and effective by the FDA, and there is no such regulation for the dietary supplements. It was the Dietary Supplement Act of something 1993 or something. So in general, if things appear that they're proven, then I agree with it. But there's no proof for any of this stuff that I am aware of. And the problem is that funding studies for these kind of things, you know, a lot of times drug companies fund it themselves to see if it is effective. And funding of something like ginger, or, you know, I mean, there's just not probably somebody who's going to want to pay to find out about that. I generally discourage dietary supplements just because we don't know about them and they're not proven. I don't take them myself, but I don't think that it's crazy to do it either. Yes, sir, in the back.
This is not a joke, but I exercise a lot, so I'm not looking for the solution, but I heard somewhere that scientists were working on a pill to replace exercise. I knew they would laugh, so I looked it up, and here's proof. And I'll read the first paragraph. Scientists at Melbourne University have revealed they have discovered a drug with exercise-like effects on muscles. The drug does not yet replicate all aspects of exercise, but it does target a specific aspect, which contributes to burning fat that leads to cardiovascular disease and type 2 diabetes. They're actually working on a pill to replace exercise.
Okay, the question is there a pill to replace exercise? And I found this interesting because he and I spoke about this at the break. I think that eventually, probably that will come to pass. I'm not sure if this will be the pill or not. I'm sure that there are going to be some things that are going to replace some of the things that we do now. I am skeptical that it'll completely supplant exercise totally, but who knows? And it's interesting, and it just goes to show that you know, science is working on everything, I guess. Yes, ma'am.
I'm currently doing a low-carb diet to drop some weight, but it's been in the news recently that low-carb diets may not be as healthy as has been thought in the past. Do you have any thoughts about that?
The question is, are low-carb diets effective? Should I not be on it? There was something in the news recently that was showing some skepticism about it. My take on things is that the scientific data to show a preferable diet over another one is not really there. I think that if you're trying to maintain ideal body weight, the diet that works for you is probably good. There was a New England Journal study in 2009, which I think from my way of understanding has been the best study yet on dietary components. They had low carb, they had high carb, low fat, and so forth, and they compared all these, and there was no difference between them, basically. However, I have spoken to too many people who were on a low-carb diet which seemed to work for them to be dismissive of it. And that's why I say, I mean, perhaps there are some people who respond better to a low-carb diet. I think that a low-carb diet could conceivably satiate people more. If they eat more protein and fat, that seems to make people feel fuller longer, so they may be actually decreasing the total amount of calories that they take in. And I think that may be a reason that it works. But as far as proven benefit, no. But if it works for you, then I don't care what's proven. I'd probably keep doing it. Parenthetically, I've actually seen people who have been on a low carb diet who are not eating foods that I would consider generally very healthy, like, you know, bacon and all kinds of fatty foods, but they lost weight and their cholesterol profile improved, not because of the diet, I'm sure, but because of the weight that they lost. In general, what I recommend, because eating fat has twice as many calories per gram as protein or carbohydrate, is that it makes sense to me to have a diet that's high enough in protein, but probably has more carbs and less fat. And I think that has worked for me. But I would not discourage somebody who is using another diet to maintain weight. Although if they lost the weight, then I might say, well, why don't you liberalize your carbohydrates a little bit. As just an ancillary, you know, there are still articles all the time about how sugar is so bad for us. And I'm just not convinced that it's all that bad. It's empty calories, but I mean, if you eat sugar every once in a while, some people consider that like poison, and I'm just not convinced. I think you can eat it every once in a while, you just have to use common sense when it comes to it. Yes, sir?
On the same lines as the question, low carbohydrate diet, can you comment further on the use of artificial sweeteners?
The question is, what about artificial sweeteners? And I think that if you have diabetes, it makes sense. There's a question as to the safety of the artificial sweeteners also. There's even question as to somehow it fooling the body so that you gain weight anyway, and I don't know the validity of that. In general, I would recommend it for people who have diabetes if they want a sweetener. Otherwise, I would not. I'd just use sugar and sparingly. I mean, I'm not promoting sugar here. All I'm saying is that using some of it is probably not going to kill you. Yes, sir?
Ibuprofen, side effects, and minimum dosage, or
Okay. All right. The question is, what about ibuprofen and the side effects and the dosage? Let me talk about the two common ones that are two common classes of medicine that are available over the counter. One is the ibuprofen group, which I call NSAIDs, non-steroidal anti-inflammatory drugs. And that would be ibuprofen, which is marketed as Advil and Motrin, and also available generically. And also Aleve, which is naproxen. They are interfere with pathways that so they can relieve pain, and they also relieve inflammation. Okay, so and what I would generally recommend if you're going to use it is a high enough dose to help. So that would be for the Advil or ibuprofen, probably 600 to 800 milligrams at a time. Taking one at a time may just be underdosing it. But I would also try to avoid it on a long-term basis because ulcers, gastritis, and so forth, and actually bleeding ulcers are relatively common with it. And it also can affect the kidneys in older people, even with an occasional dose. But overall, an occasional dose, I think, is pretty safe. The other class of medicine is acetaminophen, which is Tylenol. I would recommend it first, but it does not have anti-inflammatory medicine properties. It just has pain relief properties. It seems to be safer, but an overdose of it can cause fatal liver disease. It is something that we see relatively frequently in suicide attempts, and it's a terrible thing for people to overdose on, because sometimes they've had to get a liver transplant basically for,
Tylenol?
Correct. There also is question as to whether on a long-term basis you could get some hepatic dysfunction, liver dysfunction from using it as prescribed. In general, in the past, it was thought that 4 grams a day of acetaminophen, which would be 2 extra strength Tylenols 4 times a day, was safe. I would say maybe make it 3 grams a day. But it seems to be safer overall. It does not cause gastritis or ulcers or GI bleeding or renal problems like the other, but there are potential problems with anything.
Yes, ma'am.
What is your recommendation about alcohol usage in general?
If you don't use it, don't start. If you do, limit it to 2 drinks a day for men, 1 drink a day for women. I drink alcohol from time to time, and so and that, after I wrote my book, some people are surprised at. I think it's okay, you can be healthy without it, but you have to be careful. It's potentially like grabbing onto the tail of a dragon. Yes, sir.
I've heard it said often, but is inflammation the basic cause of everything that goes wrong in the body?
The question is inflammation the cause of everything that goes wrong in the body? I don't think that we know for sure, but it is responsible for a lot of things that we don't usually think of in terms of inflammation. I mean, obviously arthritis, rheumatoid arthritis, that's inflammation. Infections are due to inflammation, but even things like perhaps strokes and heart attacks have to do with some inflammation in the body too. Whether cancer is related to inflammation, I don't know, maybe in some circumstances perhaps. The problem is what do we do for inflammation? Well, there isn't anything specifically with the exception of, bless you, Joe, he said achoo. Yeah, and I would not take ibuprofen daily to try to decrease inflammation with the hope that you're going to prevent some illnesses, although part of the reason that you take aspirin is perhaps related to the anti-inflammatory property. Yes, ma'am.
I have osteoarthritis. I can't take NSAIDs or Celebrex. What I found, and it's knee, thumb joints, things like that, Voltaren gel, which is now diclofenac sodium, it's a prescription rub-on, is very effective in dealing with the inflammation, which is, of course, what's causing the pain. I wondered if you are familiar with that, if you had any thoughts about that.
The question is, in people who are unable to take oral non-steroidal anti-inflammatory drugs, can they take cutaneous ones? There's diclofenac that is a gel, and it seems to be effective. Some of it could get absorbed into the system, but probably a better side effect profile than the oral, and so if it's working for you, I keep using it.
I have to say that I have some soft tissue problems too from inflammation, and the more that's absorbed, the better. I've heard it's like 10 to 15%.
Yeah, I can't tell you offhand, but I do know that there is some potential. And as long as your kidney function's okay, and then you wonder about when people take the oral non-steroidal anti-inflammatories and they have the gastrointestinal problems, is that a direct effect, which probably the cutaneous would not be involved with. Although if it gets into the bloodstream, it could, some of it could get there, but probably it is a direct effect.
Well, that was my problem. I could not take oral. By the second pill, I'd be sick. Yeah, so the other doesn't go through your stomach.
Correct.
Yeah.
Yes, ma'am.
I read that for high blood pressure, systolic, 140 used to be considered healthy, but now it's 130. Is that accurate?
Well, it depends on who you listen to. There
What was the
a-
question?
Oh, I'm sorry. Joe, come on. The question was, sorry, that there has been a change in the criteria for hypertension, high blood pressure. It used to be thought that 140/90 was okay. Or below, 140/90 or below. And there was a study called the SPRINT trial, I don't know, 3 or 4 years ago, which said that they thought that the lower blood pressures, like targeting to 120/80, was better than the 140/90. I've heard some people say that the study was not very well done and they're skeptical of it. I don't know. My take on it is that probably having it on the lower side would be most reasonable. So I take the blood pressure medicine myself. I take my blood pressure probably about 5 times a week just to make sure things are okay. What was it this morning? 91/69. But sometimes it's 118/81. And so I try to target a lower blood pressure because that's what I think makes the most sense. But it's hard to say for absolute certainty. You know, sometimes when people come in and their blood pressure drops down to where mine is, then they feel dizzy, and I recommend that they back off on the blood pressure medicine. I don't really feel that dizziness, so I figure, okay, I'm going to ride with it for now because it is variable. And that's one of the big problems, I think, with blood pressure is that it is all over the place. And you know, especially when you go in to see the doctor, there's this potential white coat hypertension. And so a lot of times I take it myself later as they're about to leave, you know, when they've already heard that things are doing okay and they're kind of reassured, and often it's lower. So, and then there's the question as to whether white coat hypertension is something that we ought to treat anyway, because if it goes up in the doctor's office when you're in a traffic jam or something like that, maybe it's going to be up too. I don't think anybody knows for sure. You know, you need to, like I say, apply common sense to it. Try to minimize your side effects, but I would say if you can treat it and get it below the 140 and below the 90, that would probably be optimal. Exactly what the optimal number is, though, I'm not sure. Yes, ma'am.
I have a very important question to ask you. If someone in my family who had a heart attack, a young person, and had a stent put in him, if a person, I don't know that much about, I don't know a thing about stents, but to come to the point, if they take care of their diet, exercise, health, is it possible that they could live a pretty normal, long life? A stent, what is a stent?
The question is, there's a family member that has had stents, and this is in the heart, is that correct?
Yes.
The question is, can they live a long life, and what exactly is a stent? Okay. So when people have coronary artery disease, that's what I refer to as a plaque buildup in the coronary arteries, which are the arteries that supply the heart with blood. They're not very big. They're maybe at biggest the size of a pencil. So you would think that we would have been designed with a bigger artery to supply that, because it doesn't have to be narrow that much to cause big problems. So when a heart attack occurs, there's complete obstruction of the coronary artery, and so a little area of the heart muscle dies. If there are symptoms of chest pain with exertion, sometimes that means partial obstruction, not complete obstruction, so there's no heart attack, but people still have coronary artery disease. So in order to open up that area of obstruction, what the cardiologist does is feed a catheter into the coronary artery, squirt some dye to find out what's what and what the anatomy is, and then if there is narrowing, they usually have a balloon on the end of the catheter which they blow up, and it kind of smashes the cholesterol plaque against the side of the wall of the vessel and opens up the caliber of it. And then a little tiny metal tubing or titanium tubing called a stent is put in there to keep it open. And afterward, it's very important to take medicines that interfere with the platelets, like you may have heard of Plavix and of course aspirin, to keep a clot from forming. In-stent thrombosis can occur afterwards, so you have to take these medications. But it seems like if there's not significant damage to the heart muscle itself, that people can lead a very long life afterward. It doesn't have to necessarily interfere. It's better, of course, if you can not have a heart attack first to determine this, but you know, it is what it is sometimes, and if you had the heart attack, as long as it didn't damage the heart muscle too much, that you could live a good long life. Yes, sir.
I take 12.5 prednisone a day to manage body inflammation. And I've been doing that for a long time. Tell me the risks I'm running here with taking 12.5 milligrams of prednisone.
The question is, what risk is there to taking long-term prednisone? And do you know the type of inflammation that is, and this is being prescribed by a rheumatologist or a,
Yes.
Okay, yeah. So, and this is probably being prescribed by a rheumatologist. And you know, the problem with rheumatology, I really didn't like rheumatology because there were so many overlap syndromes, and it's hard to tell what people have sometimes. It was pretty clear, you know, when they came in with wheezing and shortness of breath that they had asthma, and so you know. But for the rheumatologists, it's difficult sometimes for them to decide exactly what's what. And there is no question that using very potent anti-inflammatory medicines, we talked about NSAIDs, non-steroidal anti-inflammatory medicines. Prednisone is a steroid anti-inflammatory medicine. It's probably the strongest anti-inflammatory medicine, or one of the strongest ones that we have available. But it comes with lots of side effects. And I'll just review them quickly because I say this all the time in the office, but weight gain, thinning of the skin, a hip degeneration problem, easy bruising. It can cause infections because it suppresses the immune system, cataracts, high blood pressure, diabetes. So there are lots of things that it can do, but I also accompany that with but. It does help a lot for certain things, and so, you know, it's easier, I think, if somebody can't breathe. You can always justify saying, okay, if you can't breathe, nothing else matters, so you got to take it. But with arthritis, it can be very debilitating too, and taking it is sometimes helpful in maintaining a good quality of life. So what I would say is that if you haven't tried decreasing it, that would be preferable. The lower the dose of prednisone, the less the potential side effects, we think. So if you could decrease it to some degree, then that would be helpful as well.
Doctor, prednisone jacks your blood sugar up too. The doctors never tell you that, the cardiologist.
Oh, I just said it.
Blood sugar.
The question is blood sugar, and I said high blood pressure and diabetes. Yes, that's the blood sugar. You can unmask diabetes. Yeah, that's what diabetes basically is. And yes, it does. And I think that most doctors do actually say that. I say it every single time that I prescribe it to patients, especially people who have a tendency to have diabetes or have diabetes. And sometimes it doesn't bother the blood sugar at all, but at times it can make it go really high.
They tested me, I was on prednisone and I didn't have diabetes, and the doctor said, go straight to the emergency room, you have diabetes. Luckily, the cardiologist gave me a lot of water, so what you have for breakfast, you have sweet roll, blah, blah, blah. You know, prednisone is dangerous.
It definitely is prednisone is dangerous was the comment, and I certainly agree with that. But it is a two-edged sword. It can be very helpful, but it does definitely have side effects. Yes, ma'am.
Yes, I was wondering, recently my doctor put me on a statin saying that my cholesterol has always been good, and in the last test it was elevated a little bit, but she said once you reach a certain age that we put you on a statin to just reduce your risks. I haven't had any side effects that I know of, but...
The question is, should we be putting statins in the water supply? And there may be some evidence that would be helpful for some people. We think that keeping the cholesterol under good control is going to decrease the likelihood of developing arteriosclerosis, hardening of the arteries, leading to coronary artery diseases and cerebrovascular disease, so strokes and heart attacks would be lower. I think that it depends on the level, on your other risk factors. You know, there can be problems with statins, particularly muscle aches. Lots of people have muscle aches with it. If you're tolerating it pretty well, it would probably be a reasonable thing to continue to take. Now, for full disclosure, I now take a statin. The way that happened is that my brother called me about 3 years ago and said, this isn't an emergency, but I've been having pain in my chest and shortness of breath when I exercise and I'm in the hospital. I said, wow, okay. So to make a long story short, he is pretty much of the same idea as I am with regard to exercise and diet. I've been a vegetarian longer than he has. I've been a vegetarian since 1979. He has for probably, I don't know, going on 30 years. But he was very healthy, so I thought, whoa, there's some genetics going on here. And as he said to me, well, I still don't have a family history of coronary artery disease, but you do. And so I ended up getting, I was going to do a stress test and do a calcium scan of my heart. If that was okay, I was just going to leave it be because my diet generally had controlled my LDL cholesterol very well. But on my calcium scan, I did have some uptake that was really high. They suggested I have an angiogram. I did, and they said I had maybe 10% narrowing. They said, you better take a statin. So that's what I've been doing. Fortunately for me, although, you know, when you're a doctor, every single side effect that you can get from a medicine is on your mind as soon as you start it. So I was riding my bike thinking, now, do I have muscle pains? Well, I don't think that I have developed that. I'm hopeful that I don't. But I do think that there is statin phobia out there, and that for some people it's better than the alternative. I mean, like I say, there's not 100% proof with a lot of these things, so sometimes we use the best data we have and apply common sense, and common sense tells me that, yeah, I'd do it, I'd have it rechecked, I'd still watch your diet, and, you know, engage in all the other healthy activities. Yes, ma'am.
Dr. Hardeman, if we could just have one last question.
One last? Okay, yes, ma'am.
Could you distinguish for us in terms of cause and prognosis the difference between hardening or thickening of the arteries, the heart arteries, versus the walls?
The question is, what's the difference between thickening of the arteries of the heart and thickening of the muscle wall, heart muscle wall? Well, the heart muscle wall can be increased so that the heart is thicker, basically. We call that left ventricular hypertrophy. It happens a lot of times in people who have high blood pressure, because the pressure means that the heart sort of has to beat harder to pump the blood through, and so it gets thicker. And sometimes with valve leakiness or narrowing, it can do the same thing, because it has to basically beat harder. And it can cause problems. It's generally not as much of a problem as the narrowing of the arteries with the coronary artery disease, although you can have coronary artery disease that is not very obstructive, and that's probably better. Obstructive is bad because it either causes symptoms of chest pain or it can lead to a heart attack. But if you have left ventricular hypertrophy, then you need to have your doctor tell you what to do about it, if anything. But it can cause problems, generally not as much as coronary artery disease does.
Okay, let's thank Dr. Hardeman.